A beautiful smile is a wonderful asset, both personally and professionally at any age. It radiates health, happiness, personality, and warmth. Are you happy with your smile? If not, you're not alone. A recent Dear Doctor poll found that 80% of us are dissatisfied with our smiles. It's actually quite normal for your smile to fade over time. As teeth age, they wear and discolor. Small chips and cracks accumulate and old fillings become unattractive. If you're interested in improving your smile, see an experienced cosmetic dentist. They are the true artists of the dental profession. Make sure the cosmetic dentist you consult is a member of the American Academy of Cosmetic Dentistry, the leading organization for advanced training in this field. Today, there are many options for enhancing your smile. Maybe you have all of your teeth, but a tooth has a large chip or crack. Tooth bonding might be your answer. If you have some minor irregularities and staining, tooth reshaping and whitening may do the trick. More dramatic changes may incorporate orthodontics or porcelain veneers as part of the solution. So how do you get started? Ask yourself these important questions. Do you dislike the color of your teeth? Do you have chips, cracks, or areas of tooth wear that make you look older than you are? Do you have a gummy smile? Are you self-conscious about crooked teeth, or do you have gaps between your teeth? If you answered yes to any of these questions, communicate the changes you'd like to see. It may be helpful to bring notes detailing your objectives and photos that show how you have looked in the past or how you'd like to look in the future. Communication between you and your dentist is an important part of this process. Your cosmetic dentist will explain your treatment options, estimate how long it will take, and of course, what it will cost. There are even ways for you to preview your new smile before the final work is done. Regardless of which procedures you choose, changing your smile is bound to change your life. It's a transformation that will open up all kinds of new possibilities that you can only truly realize when you share your dazzling new smile with the world. To improve your smile? Are you self-conscious about smiling around your friends or in your business environment? Cosmetic dentistry can offer you a solution to build your confidence and self-esteem. Choosing the right dentist is the most critical step in obtaining your desired results. Exceptional cosmetic dentistry doesn't happen accidentally. It's an art form that requires a talented professional. So how do you choose the right dentist for cosmetic work that requires such a high level of artistry and skill? And what questions should you ask a dentist who performs cosmetic procedures? A good place to start your search is by talking to people you know who've had cosmetic dentistry. Don't forget to check credentials, even if dentists recommended to you. Keep in mind that all dentists can call themselves cosmetic dentists. Research where they went to school and what continuing education courses they've taken. Most importantly, view before and after photos of their work. Referrals from other dental professionals can also be helpful. Most cosmetic dentists are eager to showcase their best work. They do so with an album of before and after photos or an online smile gallery, just as an artist would display masterpieces in an art gallery. Be aware that commercially produced before and after examples do exist, so verify that the photos you are seeing are actual patients. Fortunately, there's an objective professional source to verify claims of expertise in cosmetic dentistry. The American Academy of Cosmetic Dentistry, the leading organization in this field, has established different levels of membership that dentists can achieve based on their education, training, and demonstrated skill. So don't hesitate to ask the dentist you are considering if they are members of the AACD. Once you've found a well-qualified cosmetic dentist with a track record of achieving the results you're looking for, schedule a consultation. When the two of you sit down together, clearly explain your objectives and listen carefully to your dentist's recommendations. Communication is extremely important to achieve the smile of your dreams. Finally, cosmetic dentistry involves the work of skilled laboratory technicians, state-of-the-art materials, and multiple office visits. Expect higher fees than general dentistry, as art requires time and talent. And be careful about going with the lowest bidder. After all, you're making a significant investment in yourself and in your future. It will surely pay off as long as you have the right professionals by your side. Today we're going to talk about porcelain veneers. Did you know that a recent Dear Doctor survey found that over 80% of people are dissatisfied with their smiles? If you're unhappy with your smile, porcelain veneers may be right for you. Unlike dental crowns, porcelain veneers are wafer-thin layers of super strong porcelain. When bonded to your teeth, they can create a natural-looking, beautiful new surface. Porcelain veneers do for your smile what replacement siding does for your home. Sometimes the surface of a house becomes weathered and worn, and a makeover with new siding can do wonders. The same is true for your smile. To increase your curb appeal, you can simply replace the visible surface of your teeth, an instant improvement that makes a big difference. So, how do you achieve this? You first need a consultation with a dentist who performs cosmetic procedures to decide whether porcelain veneers are right for you. This will include a discussion of your goals and objectives and what you like and dislike about your smile. Porcelain veneers can correct many cosmetic problems. They can improve the size, shape, and color of teeth. They can also close spaces between teeth as well as lengthen or shorten teeth. Not bad for such a tiny layer of material. There are two types of veneers, traditional and no prep. Traditional veneers are extremely versatile and the most commonly used technique. Your dentist will prepare the tooth for the veneer by removing a small portion of the surface enamel, creating room for a new layer of porcelain. Because enamel is removed, this treatment is not reversible. No prep or prepless veneers do not require any surface removal and are therefore reversible. These ultra-thin coverings are bonded onto your existing tooth enamel. However, there are limitations to this procedure. Your dentist will advise you on which type is best for you. Sometimes a combination of both techniques is required. Minor orthodontics and/or whitening may also be helpful to achieving the optimal result. Your dentist will explain your treatment options, estimate how long it will take, and of course, what it will cost. There are even ways for you to preview your new smile before the final work is done. Once you and your dentist have agreed upon a plan of action, the dentist will work with a skilled laboratory technician to artistically create each veneer. Rest assured that either procedure is virtually painless and can be completed in as little as 2 visits. Best of all, your new veneers should appear completely natural. Although they are super strong, porcelain veneers are not indestructible. You should avoid hard and sticky foods. If you grind your teeth at night, wear a night guard to protect your beautiful new smile. With proper care, your porcelain veneers can last 20 years or more. Schedule an appointment with a dentist to learn more about the exciting possibilities of a smile enhanced with veneers. A sparkling white smile appeals to all who see it. Having attractive teeth can also give your self-confidence a boost. But our teeth don't always look as white as we'd like them to. Sometimes the foods and drinks we like cause staining. Smoking is another culprit. And simply aging can cause your teeth to yellow. It happens to almost everyone eventually, but that doesn't mean you have to accept it. Did you know that teeth whitening is a relatively inexpensive way to enhance a faded smile? You've probably seen many different over-the-counter products that claim to whiten teeth to varying degrees. But the strongest and fastest acting whitening solutions are only available in your dentist's office through a process known as power bleaching. This process can lighten teeth 3 to 8 shades in a single hour and can last from 6 months to 2 years. First, your dentist will protect your gums and, if necessary, the roots of your teeth to ensure your safety. Then a professional strength bleaching solution is applied. Often a special light or laser will be used to make the bleach work faster. Another way to whiten your teeth is with the take-home kit prescribed by your dentist. First, your dentist makes molds of your teeth. Then, thin plastic mouth trays are created to fit your teeth exactly, allowing you to apply the bleaching gel. In order to see the desired results, you'll need to stick with your dentist's prescribed course of treatment. While this process takes longer, it can also be very effective and less expensive. There are a few things you need to know before whitening your teeth. Potential side effects include tooth sensitivity or gum irritation, which are usually minor and clear up in a short time. Your dentist can tell you if you are likely to develop sensitivity based on the condition of your teeth and gums. Be aware that tooth sensitivity or gum irritation can become more serious if you use over-the-counter, ill-fitting trays, or if the bleach is applied by untrained personnel. Keep in mind that teeth whitening will not affect existing crowns, veneers, or fillings. Whitening is not permanent, but it is possible to slow the fading process by avoiding foods and habits that cause staining, and by doing a minor touch-up every so often. Most importantly, studies have found teeth whitening to be safe when used as directed. Teeth whitening is the most popular and cost-effective way to dramatically enhance your smile. If you're considering teeth whitening, talk to your dentist. Together, you can come up with the best plan to return your smile to its better, brighter days. Is an empty space from a missing tooth preventing your smile from looking its best? Are you having trouble chewing? Is your self-confidence affected? If so, there are ways to replace missing teeth, restore lost function, and enhance the beauty of your smile. Today, the optimal tooth replacement method, supported by decades of research and preferred by dentists, is the dental implant. So what is a dental implant? Basically, it's a small titanium replacement for the root part of your tooth that fuses to the bone and attaches to a crown. Because this is a two-part procedure, one or more highly trained dentists may be involved in your implant treatment. Here's how it works. Your dentist will examine you to see if there is enough space and bone in the area of a lost tooth. The longer the tooth has been missing, the more likely it is that the bone that once supported it has deteriorated. A major advantage of implants is that they prevent further loss of bone. If you don't have enough bone, don't worry. A relatively routine procedure, known as bone grafting, can regenerate bone where it has been lost to ensure the success of your implant. When there is sufficient bone, your dentist will insert the implant. It's usually done in the dentist's office using the type of anesthesia that's right for you. After the surgery, your dentist will give you a temporary tooth replacement while you wait for the implant to fuse to the surrounding bone, a process that can take several months. Once your implant fuses to the surrounding bone, your dentist will attach your final crown. It might go directly onto the implant, or more often, onto another piece called an abutment, positioned between the implant and the crown. You now have a sturdy tooth replacement that is visually indistinguishable from a natural tooth. What's also great about dental implants is the variety of ways they can be used to replace missing teeth. From a single tooth to implant-supported bridge work, they're very versatile. Implants can even be used to help support and retain dentures so they are more stable and function better. Research studies have shown a success rate well over 90%, making implants the most economical long-term solution available. Your dentist will evaluate any risk factors you may have, which in rare cases may prevent dental implants from properly fusing to your bone. Keep in mind that dental implants require the same care as your natural teeth. Keep up good oral hygiene at home with brushing and flossing. Regular checkups and professional cleanings will ensure the health of your gums and supporting bone, an important part of long-term implant success. If you have any missing teeth, schedule a consultation with your dentist to learn more about this life-changing treatment that can help you eat and smile with confidence. Do you have a cracked or chipped tooth? Are your teeth stained? Perhaps you have some teeth that don't match in size, shape, or spacing. One of the most significant advancements in dental technology is cosmetic bonding, an effective way to correct aesthetic problems and give you a great, natural-looking smile. Bonding materials come in a wide variety of shades to match your existing teeth. Compared to other cosmetic or restorative procedures, dental bonding is relatively inexpensive. The procedure is comfortable and doesn't generally require anesthesia. It affects your natural teeth very little and has great versatility. First, your dentist prepares the tooth surface by conditioning it with an etching solution and may reshape it slightly. Next, a durable tooth-colored composite resin is applied to the tooth and hardened with a curing light. More layers are added, sculpted, and polished for realistic finish. It really is amazing how artistic and lifelike tooth repair with cosmetic bonding can be these days, and the results are most often accomplished in just one visit. Cosmetic bonding can be a permanent solution to restoring your smile. It can also serve as a temporary restoration, while more advanced procedures such as porcelain veneers or crowns are planned. And it's a particularly great solution for kids who chip or break their teeth, a good thing since tooth-related injuries are so common among young children and teenagers. Are there any disadvantages to bonding? Well, over time, composite resins can absorb stains just as natural teeth do. The more coffee, tea, or wine you drink, or cigarettes you smoke, the more discolored your composite restorations may become. If you have these habits, porcelain veneers or crowns which don't stain and are longer lasting may be a better choice for you. Avoid nail biting, as this habit, along with any others that place excessive force on your teeth, can cause the bonding material to chip. How well your bonded teeth hold up over time is largely up to you. Adults, teenagers, and children have all enjoyed the many benefits of bonding with composite resin. Is bonding right for you? Schedule an appointment to find out. It's hard to feel confident when your smile is in ruins. Worn, damaged teeth or teeth missing altogether can make you feel self-conscious. The good news is modern dentistry can restore your smile beautifully with crowns and bridge work. When a significant amount of tooth has been lost from decay or injury, yet it's still worth saving, a crown may be your best option. Crowns fortify and restore damaged teeth, allowing them to function normally again and look like completely natural teeth. So what are the steps involved in crowning a tooth? First, your dentist will numb the area to make you comfortable. Then your tooth will be shaped to fit inside its new covering. After the tooth is prepared, your dentist will take an impression. What happens next will depend on whether your dentist makes the crown right in the office or, more commonly, has it made in a dental laboratory. There, highly skilled technicians will create a crown made of porcelain, metal, or a combination of the two that looks great and functions perfectly within your bite. This might take a few weeks, so before you leave the office, your dentist will attach a temporary crown to your tooth to protect it. At the next visit, your permanent crown will be cemented or bonded to your tooth. When a tooth is beyond repair or missing, you have two excellent options. A dental implant with a crown is considered by most professionals to be the best solution. Your next best option is a 3-unit fixed bridge using the natural teeth on either side of the gap. These teeth are crowned and then used to support another crown in between, bridging the space like a bridge spanning a river. Longer bridges can be created to span larger gaps from multiple missing teeth. There are other types of bridges as well. All of them have advantages and disadvantages, which you'll need to discuss with your dentist. Your crown or bridge work should feel comfortable and blend with your natural teeth. Restored teeth require the same conscientious care as the rest of your teeth. Be sure to brush and floss every day to reduce the buildup of dental plaque. This will help keep your smile looking great for years to come. To find out if crowns or bridge work can restore your smile, make an appointment today to learn more. Would you love to have straighter teeth but can't see yourself wearing braces? An option to consider is clear orthodontic aligners. Clear aligners are a remarkable way to improve your smile. They're actually clear plastic trays, so they're nearly invisible. This appeals to many adults who prefer a more discreet form of orthodontic treatment to feel at ease in professional and social situations. Some teenagers, too, would rather wear less obvious orthodontic appliances as they develop a positive self-image. Clear aligners can correct crowded or crooked teeth, a very common problem, gaps and spaces between teeth, open bites where the upper and lower teeth do not come together, and cross bites, to name a few orthodontic problems. So how can such a thin, removable tray get the job done? Believe it or not, the same way as traditional braces, by applying carefully controlled, gentle forces to the teeth. Here's how it works. The first step is for your dentist to evaluate whether clear aligners are right for you. If they are, x-rays and impressions are taken, and an individualized plan designed by your dentist is sent to a specialized lab. They will make the trays that will gradually move your teeth into proper position. Once you receive the trays from your dentist, you will wear the first one for at least 20 hours per day for 2 weeks, removing them only at meal times and when you brush and floss your teeth. Then it's time to progress to the next tray to accomplish the next gradual movement, and so on, until the desired result is obtained. Total treatment time will generally range from 6 to 24 months. At this point, your dentist will fit you with a retainer, just as you would wear after any other type of orthodontic treatment. Are clear aligners comfortable? They may take some getting used to, but you will adapt quickly. There are some situations in which traditional braces may still be the best way to go. It depends on your individual situation. As with any orthodontic treatment, maintaining good oral hygiene is important. Are clear aligners right for you? Schedule an appointment to find out. Did you know that more than 33 million Americans have lost all their upper or lower teeth? Complete or partial tooth loss can make you look older than you are and prevent you from eating and speaking properly. If time has been unkind to your teeth, the good news is that you have several excellent choices for tooth replacement. The most affordable option is removable dentures. Many people wear dentures, but you wouldn't necessarily realize it when you see them, thanks to the artistry and skill of dentists and laboratory technicians. There are 3 types of removable dentures: full dentures, overdentures, and partial dentures. If you have lost all your teeth, full dentures are the least expensive way to replace them. Other advantages include a more youthful appearance as the face regains support, and a return to more normal eating and speaking, all of which lead to a more positive self-image. But there are some disadvantages. Dentures will cause gradual bone loss over time due to the pressure they place on the underlying bony ridges. Also, full dentures can be unstable. This is particularly true of the lower denture, which can be moved out of place by the tongue. Overdentures can be supported by natural teeth or dental implants to provide increased stability, giving you confidence that they will not slip and cause you embarrassment. They also help to maintain bone volume by redistributing the pressure away from the bony ridges. You may only need 2 dental implants to retain a lower denture. An upper denture will need at least 4 implants. Removable partial dentures can be very stable, especially when supported by natural teeth on either side of the false teeth. And because they're removable, it's easy to keep your teeth clean. However, they can shift, allowing food to get beneath them. This movement can also cause the supporting teeth to loosen slightly over time. All 3 types of removable dentures are custom-made in a dental laboratory from impressions of your mouth. If your last remaining teeth need to be removed, an immediate denture can be made so that you're never without teeth. After your mouth has fully healed, final dentures will be made. Your dentist will make sure you're happy with your appearance and that the fit and bite are correct. Care and maintenance are important. Your dentures will need to be relined or adjusted as your jawbone changes over time. At a minimum, you should see your dentist every 6 months for a checkup. Also understand that there's an adjustment period that varies from one person to another. When all is said and done, dentures should be comfortable, functional, and look real, improving your smile and facial appearance, along with your self-confidence. To learn more about removable dentures, make an appointment today. Cosmetic dentistry has come a long way in the last several decades. Tooth-colored fillings are a perfect example. Once upon a time, having a cavity filled meant a very noticeable and not too attractive metal filling. How times have changed. Today, dentists have an impressive array of tools and materials to work with, and repairing a tooth has become a lot like sculpting a fine piece of art. Tooth-colored fillings are made of composite resin or porcelain. Composite resin is a mixture of plastic and glass that is not just good-looking, but also better for your teeth. Here's why. Metal fillings may require your dentist to remove healthy parts of your tooth with a drill to create a little ledge or undercut that locks the filling in place. Modern filling materials don't need those undercuts to stay in place. In fact, today's tooth-colored filling materials physically attach or bond to natural tooth structure. Composite resin can be applied directly onto your teeth, sculpted, and then hardened with a special light. It's really amazing how artistic and lifelike tooth restorations with composite resins are. Here's something else to consider. Metal fillings are very strong, but they're also stiff, which can actually stress the teeth and make them more susceptible to cracking. Tooth-colored fillings are strong, yet flexible. When you bite or chew, they absorb and transfer the forces similar to natural teeth. So they mimic your teeth not only in color, but also in function. When your cavity is deeper or too large to use composite resin, your dentist may suggest a porcelain filling. Sometimes, with the use of new digital technology, the dentist can fabricate the porcelain filling as you wait. More often, it is crafted in a dental laboratory and then delivered to your dentist to place in your tooth during a subsequent visit. Either way, it will be virtually impossible to tell that your tooth has a filling. If you want to find out how tooth-colored fillings can improve the look and health of your teeth, schedule an appointment today.